Hello and welcome to Best Brovaries. Today we are going to be talking about all things female reproduction, as well as explaining a very scary and painful problem that females could face as owners of a uterus. Let's go ahead and cover the basics of the female reproductive anatomy. The female reproductive system is located mainly in the pelvic cavity, as it has more internal than external structures. The external structures surround and protect the entrance to the urethra and the reproductive tract. They consist of the labia majora, labia minora, and clitoris. Collectively, these structures can be referred to as the vulva. The internal structures consist of the ovaries, where estrogen and female gametes called oocytes are produced. The fallopian tubes transport these oocytes from the ovaries to the uterus, the organ that provides nutrients and support for the fertilized oocyte from conception until birth. Inferior to the uterus is the cervix, which produces mucus that facilitates sperm movement through the vaginal canal, the structure through which babies are delivered. Within the uterus, there is a very unique tissue that is vital to oocyte attachment and growth. This tissue is called the endometrium. It lines the inside of the uterus. This lining consists of two layers, the stratum basalis, which is made up of connective tissue, and the stratum functionalis, which is made up of epithelial tissue. The stratum functionalis is deep to the stratum basalis, making it the innermost layer of the uterus. The name stratum functionalis is telling to its role in reproduction, as it is crucial to the two most prominent functions of the reproductive system, conception and menstruation. The stratum functionalis is made up of a material that thickens in response to heightened levels of estrogen and progesterone, the female sex hormone. Thickening and increased blood vessels in the endometrium allow an oocyte to attach and grow into a fetus if it is fertilized. If fertilization from a male gamete does not occur, progesterone levels will decline, causing the stratum functionalis to shed and exit the body through the vagina in a process called menstruation. While this tissue is incredibly important to female reproduction, in the uterus, it can be harmful when found outside of it.
Endometriosis is a disease that causes tissue like that of the endometrium to grow outside of the uterus. In typical cases of endometriosis, the tissue grows on the reproductive organs and in the pelvic cavity. However, in rare cases, endometrial cells can grow around other organs in the body as well. A female reproductive system maintains its homeostasis through hormonal control that operates through negative feedback loops. Hormones produced in the hypothalamus and anterior pituitary gland signal the reproductive system to go through the stages of ovulation and menstruation. Endometriosis disrupts homeostasis because endometrial tissue growth and disposal cannot be controlled when the tissue is outside of the uterus. The endometrium, both inside and outside the uterus, will respond to the hormonal changes that cause menstruation. This means that even with no place to exit the body, endometrial cells will swell, then try to shed. After becoming trapped in the body, endometrial cells will continue to do this with each menstrual period, causing surrounding tissue to become inflamed and potentially develop cysts or adhesions. In the pelvic cavity, this can cause painful period cramps, painful intercourse, and abnormally heavy flow, painful urination, gastrointestinal issues, and even infertility. Over time, bands of fibrous tissue can form, causing tissues and organs to be stuck together. It is still not fully clear what causes endometriosis. However, there are a few causes still under review. One of them is problems with the menstrual period flow. If the shed endometrium is unable to leave the body through the vagina, it will get backed up, essentially transporting the lining to another part of the reproductive system or the lower gastrointestinal system. Another cause could be genetics. Endometriosis tends to run in families, which indicates that it is inherited through genes. Any problems in the immune system can play a part as well. In a body with endometriosis, peritoneal homeostasis is damaged, meaning pathocytes and NK cells that would usually attack and remove foreign cells are unable to find and get rid of endometrial cells, allowing for the progression of the disease. This explains why women with autoimmune diseases and specific cancers have endometriosis more often than those who don't. Endometrial tissue has also been found in abdominal scars, specifically after a C-section, indicating the endometriosis can also be caused by a misplacement of the endometrium. Research is being done on how estrogen levels affect the likelihood of endometriosis, although there is a lack of solid information available at this time. The most effective way of confirming a diagnosis of endometriosis is a laparoscopy. A laparoscopy is a minor surgery where doctors insert a camera with a very thin tube into the abdomen. This surgery is also used to determine the location, extent, and size of the endometrial growths. Other ways to diagnose endometriosis are through an ultrasound, a CT scan, an MRI, or just a simple pelvic exam. There are 4 levels or stages of endometriosis. The stages range from minimal to mild, moderate, and severe. The stages are based on the location of the tissue, the amount of tissue, as well as the depth and size of the endometrium. Doctors also look at the extent of the spread, which structures and organs are affected, the extent of adhesions, and the blockage of the fallopian tubes. The stages of severity do not affect the amount of pain a woman can be in. There are women in stage 1 that are in extreme pain, while other women are asymptomatic. Treatment is chosen on a case-by-case basis, taking into consideration the severity of the symptoms and/or pain caused by endometriosis and whether or not the women want to have children in the future. If there is pain present, a doctor will prescribe pain medication. Doctors also treat endometriosis with hormone therapy. These types of hormones may include hormonal contraceptives, GnRH, or progestin therapy, which prevents menstruation, or aromatase, which reduces estrogen. With infertility being a symptom of endometriosis, a doctor may recommend seeing a fertility specialist regarding treatment. Other options for treatment are surgery. One option is a conservative surgery, and the purpose of this is to remove any endometriosis tissue from the ovaries and uterus with as little damage as possible, increasing the chances of conceiving and possibly reducing pain, though with time the pain may return and chances of conceiving decrease. The other available treatment option is a hysterectomy. This type of surgery removes the uterus and the ovaries entirely in an attempt to stop the symptoms of endometriosis, and it may not completely stop the symptoms if there is remaining endometrial tissue. This brings us to who? Any woman with a uterus can be affected by endometriosis, but is there a specific demographic that is more vulnerable to endometriosis than others? Women who have endometriosis are usually diagnosed between the ages of 25 and 40. However, it can begin to develop as early as the first period. According to the Office on Women's Health, in 2019, over 11% of women in America between the ages of 15 and 44 had endometriosis. This can be considered fairly high compared to other countries. The Endometriosis Association in the United States and Endometriosis Research Program in Puerto Rico compared women with endometriosis in their respective countries. The prevalence of endometriosis in Puerto Rico is found at 5%, which is significantly less than that in the U.S. The symptoms of both the U.S. and Puerto Rico vary in reports of symptoms, making it a heterogeneous condition. In Puerto Rico, it's estimated that 5% of the population has endometriosis, but many people report pelvic pain. Why aren't there more diagnoses? The U.S. has had more diagnosed women with endometriosis because our health care is significantly better than Puerto Rico's. Many of Puerto Rico's citizens can't get diagnosed but deal with the pain.
In conclusion, the reproductive system regulates its cycles through hormones. So when these cycles are disrupted, like in cases of endometriosis, homeostasis is disrupted as well. Thanks for listening!